This is my audience. Back up a little bit. Hi, Instructor Davis. I'm Brianna, and I would like to take a few minutes of your time to discuss something that not only affects me and you, but the entire world, which is the COVID-19 pandemic. I would like to start by defining the coronavirus. By clinical definition, the coronavirus is a variant of a common virus that infects humans and progresses to an upper respiratory infection. So then the next question that you may ask yourself is, where did it originate from? The infection that has caused the COVID-19 pandemic was traced to a live animal market in China, but is now being transmitted from person-to-person contact and spread throughout the world. Oddly enough, the coronavirus is a large family of viruses that causes common cold symptoms in humans. There is also a variant that is specific to animals and do not affect humans, which would be the canine and feline strands. And immediately after processing that information, you may begin to wonder what would happen if I contract the coronavirus. The incubation period for the coronavirus for a newly infected person, which is someone who has not ever tested positive, is 5 days. Albeit rare, symptoms can sometimes appear as early as 2 days and as late as 14 days after a person is exposed. Symptoms that may appear during that 2 to 14 day time frame are fever, cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headache, loss of taste or smell, sore throat, congestion or runny nose, nausea, vomiting, and diarrhea, all of which have been deemed non-emergent symptoms, meaning that the infected person should try to self-manage those symptoms at home and avoid going to the emergency room. But if at any time an infected person begins to experience any of the following, they should call 911 or have someone drive them directly to their local emergency room. These symptoms include labored breathing, persistent pain or pressure in the chest, changes in cognitive status, inability to be aroused or remain aroused, a change in the color of their skin, lips, or nail beds. At this point, it is likely that the infected person has developed pneumonia also. But in most cases, with someone experiencing mild symptoms, the most effective and recommended thing that a person can do is quarantine once receiving a positive test result for the coronavirus. There is no known treatment, just symptom management. For example, if someone is experiencing shortness of breath, that person will receive oxygen to stabilize their oxygen saturation levels, and that's it. Life after COVID, what is that like? You would like to think that once the virus has run its course and you now have a negative test result, that would be it, right? But in some cases, it is not that simple for some. Even persons that only experience mild symptoms may still suffer from difficulty breathing or shortness of breath, fatigue, trouble focusing, cough, chest or stomach pain, headache, heart palpitations, joint or muscle pain, insomnia, lightheadedness, and changes in olfactory senses. Meanwhile, those persons experience severe symptomatic illnesses with COVID may also experience multi-organ effects or autoimmune conditions lasting for an extensive period with symptoms persisting for weeks. It would be rare, but children can experience multi-system inflammatory syndrome, a condition when different body systems become inflamed. This can occur during or immediately after the COVID-19 infection. And lastly, I would like to go over preventative measures that can and should be taken to hopefully aid you from being infected by this virus. The most important and highly recommended preventative option would be the vaccine that has been created by Pfizer and Moderna, albeit the most controversial. The beneficial aspects of the vaccine is that it is your body's best defense against the virus and its variants. It does not protect you from contracting the virus, but if you get infected, it is supposed to lessen your chances of having severe symptomatic complications from the virus. It can also be a safe way to develop immunity. And if enough people get vaccinated, it could possibly end the pandemic. Like all things, there's a good and bad component. The most widespread reasoning for people's hesitancy to get the vaccine is fear of the unknown, along with fully vaccinated people still dying because of a complication have been infected with COVID-19. Along with the vaccine, there are other preventive measures that should be taken, like wearing a mask, proper and frequent hand hygiene, and sanitizing with soap and water are not available. These two measures are not only to protect you, but also the people around you. Social distancing is also highly recommended, which refers to maintaining at least 6 feet between you and somebody else. I hope that this speech was not only informative, but helpful, and thank you for your time.